what are special considerations in treating frail elderly patients? I hope I didn't steal your thunder there.
Yeah. So the frail elderly patient is a different sort of group to consider when deciding on treatment. How tolerable will intensive chemotherapy be for them? And one has to realize when we give intensive chemotherapy, that's time spent in the hospital, tied up to an IV, usually by continuous, that's given continuously over 4 or 5 days or 7 days. So so being in hospital is difficult for patients. And then after treatment, it usually will take 2 to 4 weeks to recover, especially for older patients who are frail and have other comorbidities. And one has to be very observant as for complications in the older patient, because you're giving them a lot of fluids with the chemotherapy, and you have to pay special attention to that, especially when they have underlying heart disease, for instance, or lung problems and or kidney problems. And it's renal problems or renal dysfunction, kidney dysfunction is it's not unusual, I should say, in older patients. As we get older, our kidneys don't work as well as they did when we were young people. So it's not an unusual problem that we have to deal with in treating patients. So can we treat a patient with less intensive treatment? And yes, we can. And as we go along and try different treatments on studies, we come up with newer treatments that can be given not in the hospital, but given as an outpatient. The patient may need to come in for 5 days in a week to get an injection intravenously, or with some agents, you can give the drug by injection under the skin subcutaneously. So important. And so one can be treated as an outpatient and come to the clinic. But there are now new drugs that are coming along that are given as tablets. And you don't have to be coming to the clinic every day to get your injection. You can take tablets, and that makes it much more easier, especially for the older patient who maybe isn't driving, needs transport, needs somebody to go with them. So there's also the social issues that come along with needing treatment as well. So important. So for the older frail patients, we often will avoid giving them intensive treatment unless we're sure they have extremely good performance status and their comorbidities are minimal. So the standard treatments that have been used are these Vidasa, it's azacitidine, or Dacogen, which is decitabine. 2 drugs that have been around for about 20 or more years. In fact, one of them's been around for more than 50 years. And it's only in the last 20 years that people have learned how to give the drug in an efficient manner. Whereas in the old days, before we knew how to give it, these drugs were given at very high doses with a lot of side effects, just out of interest. So we will usually try and use one of these hypermethylator agents, that's the azacitidine or decitabine. And these days now we try and combine it with other drugs that may increase the chance of achieving a good response and going into remission. And there are a number of newer agents that are being tested today, and there are recent drugs that have been approved to use in combination treatments. Now, these may be used at the time of the newly diagnosed leukemia, but also they are approved for treatment in patients where the disease was in remission and then relapsed. And so there are some really significant improvements in achieving a remission of the leukemia with these agents.